Good morning. My name's James Danger. I'm an embryologist with more than 50 years experience, and I'm preparing these short IVF daily takes for YouTube for IVF staff and their clients. There are more than 2,000 articles published each year on IVF and many more on embryos, sperm and oocytes and infertility. Most of these publications are locked away inside journals, and very few people have access to their contents, let alone try to understand them. One of the purposes of the IVF Daily uptakes is to try and distill and summarise these articles to a format that IVF clinic staff can quickly access and use for their own in-service education, or for clients to follow, which will hopefully give them questions to ask their doctor when they see them. I'm not a doctor, and this is not clinical advice, and all information resulting from this video should be directed towards your clinician. So this publication is about endometriosis, and this article appeared in Human Reproduction in June this year, a couple of days ago, and it links childhood experiences and endometriosis. So if I go to my summary, and basically I will just read out the summary I've written. A bit boring, I know, but it hopefully distills what's important from this study. And I have to say, reading it after 40 years or 50 years of working in IVF, and many of our patients coming through with various degrees of endometriosis, I always thought endometriosis was hereditary or just a chance event, but this paper has shown a different light of childhood experiences. Okay, so let's get started. This study from Sweden was published in Human Reproduction explores the question, is childhood adversity associated with subsequent diagnosis of endometriosis? The etiology of endometriosis is still not fully explained, and there is a need for identification and greater understanding of risk factors. A few studies have previously demonstrated an association between self-reported childhood abuse and an increased risk of endometriosis. It's a benign but potentially debilitating gynecological disorder where endometrial-like tissue, that is the tissue on the inside of the uterus, the tissue that's shed every time menstruation, implants outside the uterus, maybe getting out through the uterine wall or up through the fallopian tubes, most of which implants are in the pelvic region. Women with endometriosis have increased risk of dysmenorrhea and infertility, as well as chronic pain. Approximately 10% of women of reproductive age are believed to be affected, and although undiagnosed is common, and considerably fewer women are diagnosed and treated. Adverse childhood experience, what the authors call ACEs, are potentially traumatic events or experiences that occur in childhood or adolescence. This is quite an amazing concept for me. The concept also includes aspects of the child's environment that can undermine their sense of safety, stability, and bonding. ACEs such as parental separation, residential instability, or experience violence are very common and have been shown to increase the risk of many negative health outcomes, including ischemic heart disease, cancer, mental disorders, and diabetes. More recently, ACEs have been proposed as a possible risk factor for endometriosis, although the evidence remains limited and conflicting. The authors linked the Swedish medical birth register for cases between 1974 and 2001 with 2 identifiable parents to the National Patient Register and several other registers, and looked for cases with reported endometriosis and reported adverse childhood experiences. These included parental substance abuse, parental intellectual disability, familiar death, teenage parentage, child welfare intervention, parental separation, residential instability, receiving public assistance, exposure to violence, and parental exposure to violence, as well as parental education. The authors reported, this large population-based cohort study examined the association between a broad range of ACEs and the risk of endometriosis, and they found that all examined ACEs, except familial death in childhood, were associated with increased risk of endometriosis. And this effect remained even after adjustment for birth year, birth currency, and small SGAs. The risk increased generally between 20 and 35%, while exposure to violence was associated with over twofold increase in risk. Amazing. Further, they observed a cumulative effect on ACEs on endometriosis risk, with the risk increasing with increasing number of ACEs, reaching about 60% increased risk if there are more than 5 or more ACEs. Most ACEs remain significantly associated with endometriosis after adjusting for all other factors and other independent effects. They suggested several biological mechanisms that may underlie this association between ACEs and endometriosis. One is that through alterations in the immune system, which is believed to play a key role in endometriosis development and progression, as childhood maltreatment has been associated with chronic symptomatic inflammation and elevated inflammatory markers. Supporting this, immunological disease associated with childhood adversity occurs more frequently in endometriosis patients. They concluded, in this large population and register-based cohort study, they observed a positive association between several indicators for childhood adversity and the later risk of developing endometriosis. This risk increased with cumulative adversity. Increased knowledge of potential risk factors for endometriosis might aid clinicians in improving the accuracy of diagnosis and the care of endometriosis patients. Future studies should shed light on the mechanism underlying these associations. So it may well be that if you are attending a gynecologist and you're talking about endometriosis, you may like to bring up any aspect of childhood, adverse childhood experiences. In summary, the childhood adversities, including parental substance abuse, parental intellectual disability, parental psychiatric disorder, having a teenage parent, childhood welfare intervention, parental separation, residential instability, receiving public assistance, exposure to violence, and parental exposure to violence were all linked to a high degree risk of endometriosis, and this risk increased with the increasing number of adversities. The wider implications of these studies is that it suggests that early life adversity is associated with risk of being diagnosed with endometriosis. This finding could help guide further research. It also strengthens the already large amount of information showing that childhood adversity has a profound effect on future health and that there is a need for effective policies to protect children and support parents. Additionally, clinicians might need to be aware of childhood adversities as a potential risk factor for endometriosis development and to make sure to offer, through gynecological evaluation, individuals who experience childhood adversity and present with pelvic pain or dysmenorrhea. A rather disturbing paper, I have to admit, but one which I think now that's brought to light is very important. Thank you.